welcome to the RV Inspection and Care podcast and video. I'm Dwayne. I'm a certified RV inspector, and today we're going to be talking about the best full-time RVing health insurance plans that are available. Yes, there are a lot of full-time RVers. Many of them are self-employed, or at least they're not employed by a company that provides benefits like health insurance plans. Sometimes they have families with them. Often there is no permanent home. You know, the RV is the home. And they very often travel widely in the U.S., which means that they could be almost anywhere, anytime that a healthcare issue arises. So all of those circumstances put together means that health insurance for full-time RVers isn't simple. It isn't easy. However, there are some good options to choose from, and that's the good news. Now, let me make this very clear. I am not an expert in health insurance, but I am a full-time RVer and have been for a few years. So I'm happy to share what we've learned because we've had to make these kind of decisions. Hopefully what I'll cover here will help you choose the best option for you and your situation. Now, the first kind of plan that I'm going to talk about today is the one that we chose when we first started out full-time RVing a few years ago, and that is that we chose an Affordable Care Act plan. Now, you may know it as it's more commonly called as Obamacare. And you can find these plans on a website called healthcare.gov or G-O-V. There's a lot of good things about these kind of health insurance plans for full-timers. The first pro we'll talk about is that it provides comprehensive coverage, major medical. So it means that you're going to be covered for pretty much everything. The second pro is that if your income is a little low, which is the case many times when people first start out full-time RVing, well, they will subsidize your monthly premium. And that's a big help for many. And the third pro, and this is a big one, is pre-existing conditions are covered. That's huge. But there are cons as well for these plans. And the first con is that you will be limited to the plan choices that your domicile state is offering. What that means is whatever state you choose as your home state when you begin full-time RVing, well, you can only use the plans that they are offering in that state. The second con is many of those plans may not provide health care coverage outside that state. So you could be across the country and need health care and have to come all the way back to that state. Now, for us, our domicile state had a plan that was usable all across the country. We used it on several occasions, but that may not be the case where you are, so be sure you check it out in advance and know what coverage you have. The second kind of healthcare plan we're going to talk about today is private insurance plans. Remember, we were covering the fact that ACA plans can subsidize your monthly premium for low income. Well, if you have a higher income, they really nail you hard. So if you have higher income, then it might be best to actually choose a private health insurance plan. The number one pro is it will be less expensive if you go that way. The big con here is they usually don't allow pre-existing conditions. So that's important. The third plan we want to talk about today is not really a full health insurance plan like we usually think of. It's certainly not comprehensive, and that is reimbursement plans. Now, they are going to tell you what they will cover, and everything else is excluded. but they will list the health issues they cover and provide a cap on the expenses they'll cover. They often pay out in cash when you have that issue, but there is a ceiling to it. So clearly it's not comprehensive, it's not major medical at all. And that means that this kind of coverage is usually best used as a supplement. For instance, if you have a plan that's an ACA plan with a high deductible, you might use a reimbursement plan to fill in where those deductibles are. Let's move on to the next kind of plan. That is a short-term health insurance plan. These are often used by folks who leave their job and they aren't going directly to another job. They need a short-term plan for coverage. And the pros here is that, first of all, it's low premiums. Second of all, you can enroll pretty much any time in these kind of plans. But there are cons. Number one, it's not usually fully comprehensive major medical coverage. And in fact, they often come with some exclusions. And the last con is usually no pre-existing conditions will be covered. All right, let's move on to our fifth kind of health insurance plan to consider. And it's a unique one. It's called health sharing plans. These are usually faith-based, which means they're often associated with a church or a religion of some kind. They very often reimburse you for your health expenses. So in other words, if you have a healthcare problem, you pay for it, they reimburse you after the event. Now, the pros here are that, number one, they are low cost, and this has attracted a lot of full-time RVers. The second pro, they can be used almost anywhere, and that's huge. But there are some cons as well. These kind of plans have requirements that come with them, and they usually center around beliefs that that organization has. And if they don't align with your beliefs, well, then it may not work. Also, the second con is there have been some problems with some companies in this field that have not reimbursed some people as they feel that they should. So be sure that you research these plans well and look over the reviews very carefully. Now, the next plan we're going to talk about is telemedicine. And what this is having availability to a doctor 7 days a week, 24 hours a day, wherever you are, through the telephone or over the internet. It gives you quick access. Now, these are best used, and the really big pro is that you have access to a doctor without having to go anywhere, and for small matters, small issues like infections and things along that line that can be taken care of with a prescription, this is really good. But the big con is, again, it's not major medical. This situation is not good for trauma issues. It's not good for surgery or any major healthcare problem. So again, it only works best as a supplement to other forms of insurance we've talked about. Now, the last kind of health insurance plan that I'm going to talk about today is the one we're currently using, and it's Medicare, and specifically Medicare Supplements. You could use Medicare alone, but they have a lot of deductibles that can be pretty sizable at some times, and therefore you could have a lot of out-of-pocket expenses with Medicare itself. But there is a wide array of supplement plans available that fill in those areas, those deductibles. And since we are over 65 and glad to be here for the health insurance at this point, then it has worked very well for us. Let me cover some of the pros. Number one, you have access to any doctor, any hospital, anywhere in the U.S. that accepts Medicare. And most of them do, or many of them do. Number two is it is affordable when you consider what you're getting. The kind of coverage you can get with a good Medicare supplement really is amazing, and it's well worth the money. And the last pro we'll talk about is these kind of plans are able to keep your out-of-pocket possible expenses really low, so it manages your health care risks very well. What are the cons then? Honestly, so far we haven't really found one. We're really happy with our Medicare supplement plan. And that's all the plans I wanted to cover with you today. I think you can see there's a lot to consider before you make the best choice for you. But let me end with this other point. There is a popular RVing organization, and they have partnered with a company called RV Insurance Exchange, who claims to be made up of all full-time RVers. And they say that they can help you choose among several types of plans, many of the ones we covered here today. And in addition to that, they even say that they offer group plans for self-employed entrepreneurs who are full-time RVers. So it may be something you want to check out on that score. I'll provide a link to their website in the description of both the video and the podcast. Well, I hope this video is going to be helpful for you and will help you have more viable options for healthcare insurance if you are or if you plan to become a full-time RVer. And that's it for now. Have safe and happy travels, my friends. Until next time.